Hi, I am New York State Senator Alessandra Biaggi, and this is Dispatches, a collection of opinion and analysis from the briefing. Today is August 5th, and this is an update on the COVID crisis at Rikers Island. I represent the 34th State Senate District, which includes Rikers Island. From Mount Vernon to Allerton Avenue to Rikers Island, the people and the communities in my district have been some of the hardest hit by COVID-19. For many years, progressive New Yorkers, criminal justice advocates, and community organizers have been working to close the Rikers Island jail. This year, after significant bail reforms, the population at Rikers has been reduced. However, it is not nearly enough, and rolling back the reforms, especially during a pandemic, should be unthinkable. Instead, we need to do more to protect the incarcerated people who have not been released and work to ensure the release of more New Yorkers as quickly and as safely as possible. The infection rates at Rikers are astounding. Currently, 288 people in custody of the New York City Department of Correction, or 7.3% of the city jail population, have been confirmed as COVID-19 positive. According to courageous whistleblowers at Rikers, the New York City Department of Correction has not been taking the protective measures it promised to implement. Social distancing and mask wearing are inconsistent, and the facility is poorly ventilated. Some incarcerated individuals sleep in beds only a few feet apart. Correctional officers and other staff move between units used to detain COVID-19 positive individuals and the rest of the jail, potentially spreading the virus throughout the entire facility. At a bare minimum, we need transparency and thorough data. The more information that we have to access, the better equipped we will all be to make thoughtful decisions on how to support incarcerated individuals during this public health crisis and also to save lives. Until very recently, only a current rather than a cumulative count of individuals in custody who were confirmed COVID positive was made available, representing all individuals detained by the New York City Department of Correction, not just those at Rikers, its biggest facility. Not only do we need the existing data to be more transparent, we need more data, period. There is no public reporting of confirmed COVID cases in custody by race or even which facility they are located. In New York, we've been able to slow the curve because we have had data to inform the steps we have to take. We have not been able to do that, however, within our jails. The Legal Aid Society has made repeated requests for more transparency and information from New York City Correctional Health Services, the Department of Correction, and the Board of Correction so that we can better understand the scope of coronavirus transmission in New York City jails. But more transparency is not enough to stop the spread of COVID among our jail population. We need to safely release many more people from Rikers Island. Releases have been too slow and too few. Under these extraordinary circumstances presented by the pandemic, the city has found ways to decarcerate and safely bring individuals back into the community. This must be the new normal. We cannot afford to return to business as usual. There are three important solutions that I have called on Governor Cuomo and Mayor de Blasio to implement to safely reduce the jail population at Rikers Island. First, we need to expand the release of our most vulnerable inmates. Vulnerable individuals include elderly inmates, individuals who are immunocompromised, pregnant women, people with chronic health conditions, and individuals with asthma or other forms of respiratory health problems who are way more susceptible to severe complications if they contract COVID-19. Second, we need to stop the practice of incarcerating parolees for technical violations to reduce the jail population density and the number of people cycling through our jail system, and to maintain safe social distancing protocols within correctional facilities. In New York City alone, the New York State parole system has kept hundreds of people in jail during the pandemic for what they're calling technical violations, like missing an appointment or phone calls with parole officers. 2 people who died in city custody from COVID-related illnesses were in jail for months for this very reason. Jailing people on technical violations does not keep anyone safe. Third, we need to end the cruel and dangerous practice of solitary confinement. The United Nations dictates that any amount of solitary confinement exceeding 15 days is a form of torture. but our laws exceed that number. This is a direct attack on the physical and mental health of incarcerated New Yorkers. Putting someone in isolation without access to the medical treatment, exercise, fresh air, and programming that they need to stay healthy will only break down a person's immune system and make them even more susceptible to health problems or complications from COVID. Solitary confinement is not the same as quarantine, and it should never be justified as such. We must pass the Halt Solitary Act in the state of New York immediately. Now is not the time for lawmakers to shift their focus away from the systemic failures that create any of these dangerous conditions in the first place. As long as systems of mass incarceration are still operating within our communities, equality, justice, and public health will continue to be at risk. Nor is it the time to give into the fear-based attempts to roll back bail reform and return to a system which disproportionately harms communities of color. We must keep on a path forward that centers transparency, rehabilitation, justice, and human dignity. I am New York State Senator Alessandra Biaggi, and this has been Dispatches